As patients, carers, members of the Philippine Alliance of Patient Organizations, we breathe disease and death every day.
It is a struggle on all fronts, physically, mentally, emotionally, spiritually, and financially.
It has its disappointments, but also high points, as we encountered kind, healing souls along the way. But just when we thought we had it tough, COVID-19 made our fears bigger and deeper.
We cannot afford another disease, nor can we afford to put up a fight on all fronts. This is not our fear alone. Never in the history of mankind that there has been a disease that destroyed and disrupted so many lives and hope all over the world.
The COVID-19 vaccine is offering us hope. It is not perfect, but at this moment, it is our best chance to stop living in fear and to start living in hope.
This will not work if only a few of us chose to be vaccinated. All of us need to get the vaccine because no one is safe until everyone is safe.
PAPO stands solidly with experts and advocates for COVID-19 vaccine. We invite you to join this call of unity as we launch Bakuna Now Na to address the infodemic and help increase vaccines acceptance.
Never in our history has there been a more urgent call to stand united, get vaccinated, so together we can overcome COVID-19.
Bakuna, now na! Bakuna, now na!
Bakuna, now na!
Bakuna, now na!
Bakuna! Now na!
Bakuna! Now na!
Bakuna Now Na!
Bakuna! Now na!
Bakuna, now na!
When it comes to how many kids Filipino couples want to have and how many kids they end up having, meron tayong nakikitang pattern. Parents usually end up with one child more than what they initially wanted. At ang pinakamahihirap na pamilya, sumusobra pa sila ng dalawa. Pag mas malaki ang pamilya, mas lumalaki rin ang posibilidad na maging mahirap ang pamilya. Poverty leads to children growing up not reaching their full growth and productivity potential. Responsible parenthood and family planning is one of the 3 program components of the Philippine Population Management Program. Tugon ito sa pangangailangan para sa epektibong pagpaplano ng pamilya. RPFP has 3 goals: 0 unmet need for modern family planning, pataasin ang paggamit ng modern contraceptives to 65%,
at maiwasan ang di inaasahang pagbubuntis,
lalong-lalo na para sa mga mahihirap na kababaihan. Sa Sa RPFP, matutulungan ang mga couples na ma-achieve ang tamang pag-aagot ng pagbubuntis at ang bilang ng gusto nilang maging anak na kayang bigyan ng maayos na tahanan at kinabukasan. May iigtingin ng kampanya para maipatupad ang Responsible Parenthood and Reproductive Health Law at Executive Order No. 12 sa mga lokal na pamahalaan. We'll use communication campaigns to promote responsible parenthood and family planning, natural man o artificial methods, upang tumaas ang demand para rito, especially among poor women and families. Ilalapit natin ang reproductive health services at contraceptive commodities sa mga mahihirap na komunidad para ma-access ng sino mang gustong magplano ng pamilya ang family planning method na hiyang sa kanila. With the Responsible Parenthood and Family Planning Program of the Philippine Population Management Program, we'll make sure that couples and individuals have the knowledge and support they need to start the family of their dreams. Empowering Filipino families.
Labanan ng COVID-19, ang kailangan natin ay tama at totoong impormasyon, hindi fake news. Huwag ka agad maniniwala sa nababasa at naririnig. Ang pagkalat ng mga maling paniniwala tungkol sa COVID-19 ay nagdudulot ng panik, takot at maling desisyon. Laging i-double check kung saan nanggaling ang nabasa o narinig. Maging mapanuri at i-share lamang ang tamang impormasyon. Sa wastong pag-iingat, ang virus hindi kakalat. COVID-19, kayang-kaya nating tapusin.
Patuloy pa rin ang laban natin sa COVID-19. And together, we can beat the solusyon.
B. Bawal walang mask.
I. Isanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Kumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
BIDA. Be the solusyon sa COVID-19.
Magandang gabi po sa inyong lahat. Ako po ulit si Doc Dexter Galban at ito po ang Alaga Health Live. At kung napapansin niyo po, kakaiba pa po yung suot natin at parang nasa ibang lugar tayo ngayon dahil tayo po actually ngayon ay nasa Okada, Manila dahil napangalan po ang iyong lingkod at kasama na rin ang Alaga Health bilang isa sa mga awardees ng Asia Pacific Luminaire Awards. So with that, napakaganda po ng ating episode ngayong gabi dahil Happy Pride Month po sa ating lahat. And of course, to kick things off, we always have to introduce our very special guests for the evening. At ngayon po, of course, umpisahan natin ang ating resident celebrity psychiatry consultant, none other than Dr. Joan Perez-Rifareal. Good evening, Doc Joan.
Hello, Dr. Dex. Good evening and congratulations, Dr. Dex. Grabe. Congratulations. I am so proud of you. And really, I am so proud of you. And happy Pride Month to everyone, to all members of the LGBTQ community. Happy Pride Month. And let's celebrate. Thank
Definitely.
you.
Thank you, Doc Joan. And of course, samahan siya ng ating resident primary care physician, none other than Dr. Via Roderos.
Hi! Good evening po sa ating mga viewers. Live from Okada, Manila po kami, no? So, syempre, happy Pride Month po. And of course, Dr. Dexter Galban naman. Congratulations for another achievement, no? And of course, we are together with Alaga Health in celebration for the achievement of our very own Dr. Dexter Galban. And of course, for our brothers and sisters from the LGBTQ plus community, no, happy Pride Month sa inyong lahat. I'm sure kami ni Doc Joan ay marami na namang pag-uusapan, no, na maganda at very informative ngayong gabi, no. So hi Doc, nice to see you again.
Yan, thank you very much to our lovely and beautiful doctors. And of course, hindi kompleto ang Alaga Health Live kapag wala tayong mga special advocacy champions. And of course, dahil advocacy natin ngayon ang Pride Month and championing the LGBTQI+ community's health and well-being, kasama natin from the Commission on Population and Development, none other than, first, we actually have two from POP tonight. First, we have from the INCB, Miss Mai Quiray. Hi, Ma'am Mai. Good evening po.
Good evening! Congratulations, Commissioner Dex, your Popcorn family is very proud of you. Good evening po, Doc John, Doc Via. You look so blooming, both of you.
Maraming salamat po, Miss Mai. Of course, kasama siya ngayon ng isa pang field member ng Popcom, no? From Popcom Region 12, none other than, let's give it up for Sir Dwight Asentista.
Hello, good evening. Naririnig po ba?
Yes, Sir Dwight, we can hear you
Yan,
loud and clear.
Thank you very much po. And nagka-problem lang po in a while sa aking connection. But again, kay Dr. Dex, maraming salamat po sa pag-invite sa amin ni Miss Mai ng Popcom. And para po ma-promote rin po yung aming advocacy sa SOGIE as well as sa atin pong gender and development. Once again, good evening po sa lahat, lalo na sa mga nakikinig po ngayon at nanonood sa ating Facebook Live. Again, maraming salamat po sa opportunity na ibinigay nyo sa amin ngayon.
Alright, maraming salamat, Sir Dwight. And of course, we have a very special guest from one of the most prominent organizations championing HIV awareness in the Philippines. We have a representative from LoveYourself Inc, and he is none other than Mr. Pete Tan. Good evening, Sir Pete. Oh, mukhang nagkaroon ng technical problems si Sir Pete. But for sure, we're gonna have him back in just a little bit. But while we're waiting, let's get started already. So maybe we can begin with Alaga Health Checkup. And this is from Dr. Cherry Bernardo-Lazaro.
Baybay ng Alaga Health and Happy Pride Month. Ako po si Dr. Cherry Bernardo-Lazaro. Ako isang family and community medicine physician. Ako din po ay isang educator at isang advocate ng primary health care and public health. Kaya suportado ko po ang maadvokasya ng Alaga Health. Kasama na dyan ang SOGIE awareness at gender equality na paksa sa episode ngayon. Kapag napapag-usapan ng LGBTQI+ patients at ang kanilang mga health issues, kadalasan ang nasa isip natin ay sexually transmitted infections, STDs, STI, or kung hindi naman ay HIV. Pero kung titingnan ay ito rin po ay masakit na nakikita natin sa mga pasyenteng heterosexual. Kaya bagaman tinatawag na common concern ito sa mga LGBTQI+ patients, ay siguro gusto ko sabihin na hindi lang ito ang mga karaniwan nagiging problema nila. Gaya ng iba nating mga pasyente ay prone din sila sa mga tinatawag na chronic diseases or pangmatagalang sakit tulad ng hypertension, diabetes, sakit sa puso, minsan pa ay cancer. So minsan matatanong bakit kaya yun naman nagiging sakit nila. Ang siguro mas mahalagang tanong ay, may kinalaman ba ito sa dalawa pang mas matinding problema pangkalusugan na kinakaharap ng mga LGBTQI+ patients natin? Ito yung stress at healthcare access, na malamang mas mapag-usapang mabuti sa inyong balitaktakan mamaya. So balikan ko lang ulit yung sinasabi kong dalawang health issues na gusto kong emphasize. One is stress. Hindi madaling magtago at hindi rin madali lumantad. Hindi po madali maging LGBTQI+ patient or population lalo na sa isang sosyedad na hindi pa ganun ka-accepting sa sinasabing ibang sexual orientation, gender identity, and expression. So, nakaka-stress kumbaga. At maaaring kaakibat ng stress ay ang pag-cope sa mga stressful situations. Kung kaya nagkakaroon ng lifestyle-related problems such as smoking, alcohol drinking, drug abuse, and poor eating habits na maaaring later contribute sa pagkakaroon ng obesity, diabetes, hypertension, sakit sa puso, at mga komplikasyon. And kaakibat pa ang mga mental health concerns na sumasabay sa mga health problems na ito. Kung kaya maigi pag-usapan ang mga health issues kasama ang inyong mga doktor. Ngayon, sasabihin mo, gusto ko na magpakonsulta sa doktor. Ang next na tanong ay, saan at kaninong doktor ako pupunta kung ako ay isang LGBTQI+ patient na may health concern? Kaya next na gusto ko ma-emphasize na problem is yung healthcare access. Minsan, ang pakiramdam nila ay, hindi kaya nakakahiya kung malaman ni Doc na ibang sexual orientation ko? Or may takot na baka mahusgahan na naman ako tulad ng dati. Mas sinasabi kasi na yung ibang nasa LGBTQI population ay maaring nakaranas ng pagmamaltrato, diskriminasyon, o kaya panghuhusga, o kaya natatakot sila minsan magpakonsulta. Kung titingnan mo nga naman, isa sa mga unang datos na hinihingi sa medical chart, o kahit siguro sa census, ay ang tanong sa sex o kasarian. At ang mga options lang na available ay male at female. Paano na kung wala sa choices para i-check ang sexual orientation, gender identity, and expression ng patient? Nakakalungkot man sabihin, ngunit kahit po sa ibang bansa, ang competency sa SOGIE awareness and gender equality, kasama na ang mga cultural sensitivity and training, ay hindi kadalasan bahagi ng education ng mga medical at allied healthcare professionals. Ngunit, may ilan din naman institusyon na nagtuturo at gumagawa na nito. At siguro, ang mga forum tulad nito ng Alaga Health ay ilan sa mga hakbang para maitaas ang kaalaman tungkol sa SOGIE awareness and gender equality para mas maging sensitive ang mga medical and healthcare professionals sa ating pakikitungo sa ating mga LGBTQI+ patients. So, bilang pagtatapos ng panimulang mensahe ito, may 3 bagay lang po siguro gustong sabihin sa ating mga LGBTQI+ patients. Kasama na dito ang kanilang mga kaibigan, family members, and community partners na nanonood sa atin ngayon. Una, do not be afraid or huwag matakot magpakonsulta sa inyong primary care provider kung may problema ang pangkalusugan. Baka po kasi mapatagal pa ang masakit na maigi maipakonsulta habang maaga. Second, be open and honest to your doctor about details in your personal and social history tulad ng sexual and lifestyle practices. Kasama na po doon kung kayo ay nakakaranas ng depresyon o di kaya gender-based violence. Makakatulong mga detalye na ibibigay nyo para sa tamang assessment, management at pagtulong sa inyo ng inyong healthcare provider. Pangatlo at siguro huling punto ko ay minsan po yung tingin nating hostility or discomfort ng doctor at healthcare professional ay maaring hindi dahil sa judgmental or discriminating talaga sila. Maaring dala din to ng kakulangan sa kaalaman. So, if you think your doctor or healthcare professional is maybe not well-versed with sexual orientation, gender identity, and expression, please do not be afraid to somehow educate them because there are a lot of us who are willing to listen and learn from you. Pero alam nyo, sa totoo lang, sa tingin ko ay malaki pa rin talaga ang kinalaman ng diskriminasyon when it comes to health issues and problems na dinadanas ng ating mga LGBTQI+ patients. Kung kaya malamang ay magiging malalim ang pag-uusap nyo tungkol dito mamaya. Tama ba, Doc Dex? Anyway, so yun lang po ang aking konting mensahe. Paumanhin po kung sakaling hindi ako makakahabol sa programa mamaya. Nandiyan naman po si Doc Via at Dr. Joan para masagot ang inyong mga karagdagang mga tanong ukol sa kalusugan ng LGBTQI+ Plus patients natin. Muli, ako po si Doc Cherry na muling bumabati sa inyo. Happy Pride Month at salamat, Alaga Health.
All right. Right, there you have it. That was Doc Cherry Bernardo, our family medicine consultant, coming in with the Alaga Health checkup. And we're so happy because tonight we're going to be discussing yung mga health issues at concerns po ng LGBTQI plus community in celebration of Pride Month. So, with that being said, maybe we can jump in to some of the primary concerns ng ating LGBTQI plus community. And of course, isasama natin dito ang kinakampiyon ng isa sa mga pinaka-masugid nating partner organizations dito. Of course, that would be the 2030 Youth Force in the Philippines. And I'd like to introduce to you my fellow ambassador from the 2030 Youth Force, and he's none other than future Dr. Mikko Argonza.
Hi, good evening po sa ating lahat and happy Pride Month po. Congratulations again, Dr. Dex, sa ating another award, no? And lalo na sa avenue natin, which is Alaga Health.
Maraming salamat, Mike. So siguro to kick things off, no, maybe you would like to ask the most common concern or health question by the LGBTQI plus community. Meron ba mga typical questions na sana pinapangarap nilang masagot ng maayos ng ating mga health professionals?
Yes, definitely. Actually, ang pinaka-common po na tinatanong kasi is, may mali po ba sa akin kung nakakaramdam ako ng feelings na tulad ng isang LGBT?
Okay, so medyo bigat yung question. I think magta-tandem answer dyan, no? So we have probably Doc Joan, probably to tackle the mental health aspect, and probably pwede rin mag-provide ng input ang ating partners from Love Yourself and even Popco. Doc Joan?
Yes, oh, hi Mikko. Sorry. Hi Mikko. Good evening. And yes, good evening. Doon sa question, yes, I agree with Dr. Dex. Medyo mabigat na question, but I would like to reassure you, or kung sino man, no, ang may questions na ganyan in their minds, in their heads, no, na walang mali. Of course, to give a brief lang, quick na historical background, prior to 1973, no, yung early 1960s to 1970s, early 1970s, kasama pa siya sa Diagnostic and Statistical Manual of Mental Disorders. So it was classified as a mental disorder noong time na yon. But by 1973, sa second edition ng Diagnostic and Statistical Manual for Mental Disorders, tinanggal na siya. Meaning, it is not classified as a mental disorder, meaning sa lahat ng mga may questions about their thoughts, about their identities, or mga feelings nila, you are all normal. Hindi siya considered as something na as a disorder or as a clinical problem. So walang problema.
Thank you for that, Doc Joan. No, siguro pwede makadagdag dito ng input in terms of the policy and actual practice, no? A tandem answer siguro from our friends from Popcom. So, Ms. Mai, Sir Dwight, any thoughts po sa tanong ni Mikko?
We recognize po, no, na napaka-real and valid ng mga questions ng ating mga kapatid na LGBTQI. Sa atin, sa Komisyon sa Populasyon at Papaunlad, tayo po ay signatory, no, Doc Dex, sa International Conference on Population, which ensures that there should be no discrimination of all forms. And also sa Convention of the Elimination Against Violence or Discrimination Against Women, signatory din ng Pilipinas. And meron din po tayong sarili nating Republic Act, no, anti-bullying, no. So against all forms of discrimination, lalo na sa sexual orientation and gender identity. And of course, ang ating landmark Responsible Parenthood and Reproductive Health Law, which ensures that everyone should have access no matter your gender identity and your sexual orientation. No? So I'll turn this over. How can this be seen in the field sa ating technical section chief sa Popcom Region 12, si Alvin Dwight Asentista?
Ayan, thank you very much, Miss Mai. Actually, Doc, no, yung sinabi nga po ni Sir Miko and ni Doc Joanne, yun yung actually mga typical questions ano during our activities na ginagawa. Yung SOGIE po na mga activity sa ating region ay ini-integrate po natin sa ating different programs, no, especially po sa ating adolescent health and development program. When we deal with adolescents, when we deal with young people, naka-integrate po ang SOGIE, no, na orientation. Actually, we have yung tinatawag po nating U4U Teen Trail, no, mayroon tayong tinatawag na teen color dyan na station wherein we talk about the basics of gender and the sex. At the same time, yung SOGIE din. Even po yung atin pong mga module sa POPCOM ay naka-integrate po ang SOGIE doon. No? And sa atin pong responsible parenthood and family planning na program, nandun din po siya. And of course, sa ating gender and development no, na program. Yung ating tinatawag na gender sensitivity training, no, mayroon din po tayong doon SOGIE na context, and even doon po sa aming program na katropa, no, yung kalalakihang tapat sa responsibilidad at obligasyon para sa pamilya. Sa mga ginagawa po namin yan sa mga all men, no, especially sa mga uniform personnel po natin. No, na ini-inject po natin yung SOGIE, and we are very sure also na amazed na sila po ay giliw na giliw no pag SOGIE na po yung napapag-usapan. So rin po kami na-enjoy kami at the same time sa pag-conduct sa kanila ng different orientations, different activities sa atin pong mga kalalakihan. So yun po yung mga programs natin no in terms sa pag-advocate at pag bigay ng impormasyon para doon sa equality na tinatawag natin, especially po sa ating SOGIE. Yan po, Dr. Dex.
Alright, thank you, Sir Dwight and Miss Mai. No? So hopefully nagkaroon tayo ng mga magandang insights regarding that. So let's probably try to answer some questions from our Facebook group. No? So let's check here. So may mga nag-comment na kasi dun sa ating publication post before nung pinapromote natin ng event na ito. At meron tayong question dito from Ma'am Felice. Medyo nahihirapan daw siyang huminga at medyo masikip ang dibdib. Ano ang dapat niyang gawin ngayon? Dr. Ravia, I think ikaw ang kailangan sumagot nito.
Alright, no. One of the concerns naman talaga, usually during that time, not only of our friends from the LGBTQ++ community, no, is the difficulty of breathing, no. Also, our friends from our own communities and our families are also experiencing a lot of those symptoms, especially since there are times na minsan to bago-bago yung panahon, sometimes there are triggers, no, doon sa mga symptoms na nararamdaman natin. And this is something that we should also take into consideration, and dapat hindi natin baliwalain, no? Because it can actually be, or it can actually mean a lot of things. Number one, it can actually be a respiratory problem or problema dun sa ating paghinga or dun sa ating baga, no? Number two, it can also be doon sa ating cardiovascular na system, no? Or doon sa ating puso, no? Kasi hindi lamang yung lungs natin or yung baga natin yung ang tumutulong para sa paghinga natin, no? What can affect that is also our heart, no? Or if may problema tayo sa ating puso or sa ating cardiovascular system, that can actually manifest as difficulty of breathing or hirap sa paghinga. So, importante po talaga that you listen to your symptoms, no? Because it can actually mean a lot of things, no? And not only that, no? Difficulty of breathing can also be because of certain mental conditions, no, or mental well-being as well, such as anxiety. No, you can also have that, no. And Doc Joan is there, no, or is pretty much well-versed in explaining that. So mamaya siguro si Doc Joan can weigh in on difficulty of breathing. But important again to listen to your symptoms because it's the first step for you to be able to really consult your doctor about it, no? Marami po kaming tanong dyan because maraming pwedeng sanhi yung hirap sa paghinga. No? So that's why we invite everyone, especially all of our friends, loved ones, family members to always ask your doctor no, kapag may nararamdaman kayo, especially those in our LGBTQ community.
All right, thank you very much, Doc Via. No, so it's good to highlight that when we talk about the concerns of the LGBTQI+ community, hindi lang ito yung mga typical na nakakabit sa kanila, no? It has to be very holistic. So siguro may mga tanong pang pwedeng idagdag sa atin si Maiko. Ano pa ba yung mga typical concerns and issues sa palagay mo maganda na masagot ng ating mga health professionals? At sana makatulong din dito sila Miss Mai, sila Sir Dwight, at sana makabalik dito maya-maya si Sir Pete.
Okay. Welcome back po, Sir Pete. So, another question po siguro na I would like to raise is on gender dysphoria. So, it's one of recent things na nag-surface because of RuPaul's Drag Race. So, a contestant there was a trans man who competed in a drag race contest. So, what is ano po kaya yung gender dysmorphia and bakit siya a big concern for the LGBT community, especially the trans community?
Oh, si Doc Joan, feeling ko kaya nito kasi
Yes.
may particular mental health concern yan. Siguro sila Ms. Mai and Sir Dwight can have some thoughts about it too.
Yeah. Yes. Oo, thank you again, Maiko. Sorry, Maiko pala ang pronunciation. Hindi Miko. Sorry. So, parang no, dysphoria, meaning hindi naman siya depressed, no? But there is that sense na parang there is dis-ease or uneasiness, na parang a feeling na hindi ka at ease that a person can have because of that hindi parang nagka-mismatch, hindi aligned ang yung biological, which is from the sex chromosomes, yung biological na which would determine the sex versus yung the gender identity. So there is that mismatch there and it's not aligned, kaya you do not feel happy pero hindi naman depressed. So dysphoria, meaning there is that feeling of dis-ease or unease about the kasi nga hindi siya aligned eh.
All right, thank you, Doc Joan. So, would you like to add anything, Ms. Mai and Sir Dwight?
I'll turn this over to Dwight to answer this since talagang sila yung nag-i-implement in the field of this program talaga.
Sige po, Sir Dwight. Would love to know your thoughts.
Thank you, Miss Mai. And yun nga po ang explanation ni Doc Joan na yung gender dysphoria na tinatawag is yung parang yun nga hindi compatible yung biological sex mo sa iyong nararamdaman sa iyong gender identity, sa iyong sexual orientation. So that's why nagkakaroon ng gender dysphoria. That's why nga may yung mga transgender natin, transgender men, transgender na women ay nagkakaroon or nakakaranas sila ng gender dysphoria in their journey, sa pagkakilala nila ng kanilang sarili. It's because yun nga hindi nagtugma yung biological sex or yung sex niya at birth sa kaniyang nararamdaman. So, yun po. Thank you.
Yeah, I think there are some technical difficulties lang. Ang hirap pala talaga pag on the go si Doc Dex, no? Straight from
Doc Bia,
straight from
before we
Yeah.
take a break,
Yes?
may I add po?
Mhm.
If there's a
Sure, go
mismatch
ahead.
that so, excuse me. If there's a mismatch that yung question po ni Miko, what is important is that you consult din talaga on what you're feeling. Like we have Doc John here, no? You consult with professionals talaga, licensed one, to help navigate your journey. No, that's what's most important if you're feeling that disparity. So that's if our kapatids are listening, so it's important talaga that there's someone professional and someone that you can trust that you can help you navigate through this journey that you're feeling. Yun
Actually,
po.
Miss
Thank
Mai, I agree
you.
with that, no? I agree with that, Miss Mai, no? Because as much as we'd love to take care of our brothers and sisters or our family members as well, we have to extend that also to our friends from the LGBT community because they would need a lot of support, no? Especially from their community, from their family and friends as well. No? So, ang ganda na pinag-uusapan natin yung mga ganitong bagay. Not only because it's Pride Month, but also because we want to ensure that the health of our friends, no, from all communities are actually taken care of, and yun yung ginagawa natin through our programs in PopCom, in Alaga Health, and of course through the advocacies of our champions here like Doc Joan, Maiko, and of course our friends in PopCom as well. No? Doc Joan, hanggang interesting ng topic no,
Yes.
regarding that.
Oo.
Especially,
Correct.
yeah.
Oo, tama yun. Agree ako with everything. And if, in fact, yung sa gender, balik tayo doon sa gender dysphoria na question ni Maiko, very important yung nasabi ni Ma'am Mai na may mga guidance, no? We seek help or guidance from mga sa mga from mental health professionals because very important talaga. Let's remember, kailangan talagang i-process. I-process natin kung may na-feel tayo na mismatch or hindi tayo comfortable with how we are feeling versus the biological na sex assigned to us at birth, mas maganda na kung hindi pa natin talaga masyadong naiisip or napoprocess yon, we process our thoughts, emotions, and proseso kasi siya, so it may take some time. And ako, always yon pag may mga those under my care na nagkakaroon din ng medyo dysphoria or medyo confusion, I always reassure na proseso talaga siya and hindi siya overnight lang na parang ma-understand mo na lahat ng mga pagbabago or changes or kung anong kailangan pang baguhin. It's really a process and meron din tayong own pacing. So, huwag tayong magmadali to find the answers kung tayo ay may mga questions in mind kasi may kanya-kanya tayong pace. So, let's find our own pace and it's always a process. I hope Maiko.
Kamusta daw, Maiko? Okay ba yung sagot nila, Doc, tsaka nila Miss Mai and Sir Dwight?
Thank you po. Mas luminaw naman po siguro din para sa ating mga viewers.
Perfect. So, I think, bago pa lalong mas lumalim yung usapan, maybe it's time for a very, very quick Alaga Health update. Okay, looks like meron tayo ng konting technical difficulties, no? But I think we can proceed, right? So probably we can dive into Alaga Health's update right now. So let's try to look at it as of the moment. So this is actually loading dito sa screen niya, makikita niyo siya, no? Yung Alaga Health website. And when you go through it, no, as you visit the website, this is exactly what you're going to see. Makikita niya, the future of healthcare. And then eventually, as you scroll down, may animations pa siya para yung Apple Store, no? And it's actually going to tell you that Alaga Health is the Philippines' first digital health marketplace and health service hub. And actually view the rest of our website. Napaka binibida po talaga namin yan dito sa Alaga Health, no? So you can browse through some of our services and all of our partners. Kasama na dyan ang ating mga partners ngayong gabi. And of course, what we're going to be encouraging you to do would be, of course, to click that button sa top right corner, yung sign up. Kasi kapag pinindot niyo po yan, i-direct po kayo ng ating system papunta dito sa registration, which is a 3-step process. So first, you get to know if you're a patient, if you're a partner, a health professional, or an admin. So you just have to click which one actually refers to you. So you can pick patient, partner, admin. So after that, you're actually going to pick yung continue. So kunyari patient ka. You just go through this approval process, part of our data privacy, as well as yung policies natin in Alaga Health. Just go down and scroll down. So you really have to scroll down bago siya magbibigay ng check mark. And then you proceed. And after that, very quick lang, just fill in your info and very, very soon, in just one more click, you will be a part of the Alaga Health family and have easy access to the Alaga Health system. So with that being said, no, we're very excited because today we are actually launching our partner app already. So hopefully everyone will have an easier access to healthcare anytime, anywhere, in every way. Oh, so that's very much it for the Alaga Health update. Balik tayo sa ating magandang usapan ngayong gabi. So Maiko, mukhang it's time to tackle the usual concerns naman ngayon of the LGBTQI+ community. Hindi mawawala sa issue natin dyan yung mga major comorbidities o kaya naman yung mga major health issues nila. Among those are HIV and AIDS. So, particularly, merong mental health component o meron din itong physical component. So, maybe, Doc Joan can give us an insight kasi for sure, if someone suddenly is said to have HIV, things are going to be running through their mind. So, any thoughts po, Doc Joan, or any advice po to our fellow members of the community or the LGBTQI+ community para malaman nila kung ano yung gagawin in the event that they have that particular condition?
Meron na ba? Meron ng sound? Hello? Yeah! Oh, sorry. Grabe ang technical natin ngayon. Ako din, nawawala din daw, sabi nung asawa ko. Yeah, let's remember, in fact, no, ang mental health concerns naman, it can affect all of us. No? Any one of us can be affected. Wala naman siyang pinipili, no, na talagang LGBTQ lang or medically ill. So anyone can be affected, although members from the LGBTQ community plus yung mga may medical health problems, they are shown, no, they've been found to be more at risk sa mga mental health concerns, na like anxiety, depression. So sila yung mas inaalagaan or binabantayan, no, because of the patong-patong, no, or sabay-sabay na ng mga medical concerns and other forms pa, no, other factors involved such as yung kasama yung na-mention ni Dr. Cherry kanina, no? Like yung ang access to healthcare, access ng, of course, because of fear of mga discrimination, fear of harassment, etc. So, sabay-sabay kasi, so marami silang hinaharap na factors which can affect their help-seeking behavior as well. So, that's why inire-remind talaga namin na all of these, no, itong mga pinagdadaanan po ng ating mga kaibigan from the LGBTQ community, please remember that you are never alone. Okay? You are never alone in your journey. We are always here. Nandito po kami to help and offer our support as allies, as partners in our yung sa holistic care for everything, no, for our physical, mental, and psychosocial well-being.
Yun, perfect. At saktong-sakto kasi nagbabalik na po. Hopefully, wala na tayong technical concern. Nagbabalik po sa ating call ngayon si Sir Pete Dan from Love Yourself. Sakto-sakto because we were just talking about the issues on HIV. And perfect because Love Yourself ang pinakamatindi nating champion when it comes to that advocacy. So perhaps, Sir Pete, can you tell us more about Love Yourself and how you can help address or assist in when it comes to the issues of HIV and AIDS, plus well as the screening programs that you have to offer?
Yeah, so again, I'm so sorry with the quite technical difficulties earlier on. But again, thank you, Dax, for the introduction and for inviting Love Yourself as well. So for us in Love Yourself, we do have two kinds of ways of trying to promote HIV awareness. So the first part is we have 6 community centers here in Manila and 1 in Metro Cebu. So all of our centers we provide a very safe space, all right, in providing a safe space to those people who are coming in, and not just about to the LGBT community, but for the whole. And then our services naman, we provide testing, treatment, and care as well. So also we do provide HRT services to one of our clinics in Pasay for our transgender brothers and sisters who wants to transition with regards to about their gender identity safely, no? And of course, because of the current pandemic situation, yes, nagkaroon po kami ng challenges during the first few months when the COVID-19 pandemic hit our country. So with us, biglaan talaga rin kami gumawa ng way. So we provide teleconsult or virtual consultation agad-agad. We provide access to services of delivering ARV meds o ang tinatawag natin yung HIV treatment medicine ng ating mga person living with HIV, no? Na dinideliver na namin sa kanila yung mga gamot sa doorstep nila because of course during those times na lack of transportation. And also we did roll out as well in terms of if people want to get tested in their comforts of their own home by buying a self-care care test kits. And ang pinakamaganda ditong news ay when we started this, it's only for NCR. But right now, we deliver it right now to the buong parts ng Philippines, from Cebu, Cagayan de Oro, and as long as Ilocos as well, and in Bacolod. So yun yung mga services that we provide. And our testing and treatment services and even doctor's consultation, we provide this for free, no? Libre siya. So this is how we do in our Love Yourself. And another thing that we provide naman in terms of outreach, again, education is the very important key, no? Education and information. Tulad nga ng sabi ng ating mga experts ngayon ng mga medical field, kailangan lang natin malaman yung tamang at saka yung mga alamin natin yung myths and misconceptions about the HIV and virus. So for us, we do have what we call Love Yourself Caravan. This is within partnership with the Filipina Shell Foundation, wherein we provide awareness sa youth, sa universities, and also sa mga business establishments as well. Before we've been doing this since 2015. We even go out to the centers or to their workplace or to their universities in providing free HIV testing. Actually nga, kagagaling ko lang ngayon sa isang outreach ng HIV testing sa Barangay 183 sa Villamor, Pasay. So ayun, nag-provide na kami ng HIV testing. Again, ito po ay libre. And of course, in Pride Month, there are lots of organization or business establishment that invite us to do virtual talks about awareness, not just about HIV, but also about SOGIE, gender identity, and even mental health. And also, of course, the basics of STIs. So yun po.
Ayun. So thank you very much, Sir Pete. I think sobrang swak yung pagbalik niya dito sa ating call, no? But before we go again any further, maybe it's time for a very quick detour through our Alagang Hello Doctor. Yon. So, welcome to Alaga Hello Doctor. So, every week we feature one of the articles by our partner organization, our partner entity, Hello Doctor. So, they're part of the Hello Health group. So, this is actually what you can see on their website. And since we're celebrating, we're actually just talking about concerns of the LGBTQI plus community, particularly HIV and AIDS. You can see they have actually a section just for that. No, you can browse it on hellodoctor.com.ph. So you can actually, from their landing page, you can check so many different topics. So let's put a particular focus on one of them right now. No? So let's click on that button right. So quickly, how quickly can HIV be transmitted? So find out there. So once you click that article, you can see kung sino nagsulat sa kanya and you can browse through it. You can look at all of the information. Ang maganda dito, lahat ng information na makikita nyo dito ay medically validated by a team of medical experts and health professionals. So makasisigurado kayo na yung mababasa nyo, tamang-tama at approved ng medical community. And apart from that, you can see all of these beautiful graphics, as well as you can actually reach out to the ones who wrote it if you want more information regarding the topic. And to add to that, no, you can jump to the actual landing page of hellodoctor.com.ph and you can see all of the other topics that they have to offer. So hopefully, you get to visit Hello Doctor soon. So, balik tayo. I think we're actually about to run out of time. So just very, very quickly, maybe it's actually time for a very, very quick wrap-up. Yan. So welcome to the wrap-up, no? So let's go around the room and probably ask everyone to give us very, very briefly, no, their final tips or advice or probably health information that they want to highlight when it comes to the concerns of the LGBTQI community, as well as those persons living with HIV. So perhaps we can begin with Michael. Very, very quick thoughts, final message.
Final message lang po siguro, Doc Dex, is that for everyone, no, since sinabi po ni Doc Joan kanina that understanding or finding out about your own identity is a long and tedious process, for those of us na probably hindi kinailangang dumaan sa ganon, mas matinding pasensya at pang-iintindi ang kailangan natin para sa mga kapatid natin at mga brothers and sisters natin na pinagdadaanan yung pag-figure out ng kanilang sariling identity.
Maraming salamat. Ganda ng sinabi ni Michael. So maybe now we can ask the final thoughts of Sir Pete Tan, representing Love Yourself Incorporated.
So for me talaga, it's more on really about focusing and try to be open-minded in terms of knowing the information. For us, my experience in doing the outreach program, when we always discuss about HIV, ang dami minsan sa audience sabihin, nako, hindi ko kailangan malaman yan. Di ba? Hindi ako part ng LGBT. Hindi ko kailangan malaman yan. Hindi ako sexually active. May asawa na ako. May mga anak na ako. Actually, that's the main point. Because it doesn't mean that if you are in that kind of situation at hindi na natin, ito-close na natin yung utak natin for that. But we have to remember, we surround ourselves with different kinds of people in everyday life. So a person can be living with HIV or struggling about HIV or sometimes want to get tested but are very afraid to do it. And dapat na andun kayo to provide that person a safe space. At least nalalaman nyo yung tamang impormasyon. How can I help this person? Whether if that's your kid, whether that's your cousin, whether that's your pamangkin, whether if that's your colleague or even your loved ones, no? I think it's that kind of openness and dapat magkaroon tayo ng deeper understanding for that we should be open in terms of when we discuss about these things. Yun nga yung iniisip kasi natin na pag sinabi, ay, hindi ko siya kailangan malaman because it doesn't involve me. But that's the thing. you are surrounding yourselves with different kinds of people, so eventually you will be affected as well. So yun yung gusto ko sanang paalam, no? Hindi magiging dapat hadlang na magdagdag kaalaman para sa atin. And even not about just about HIV, even what we're happening right now in the COVID-19 pandemic. No, minsan nagsasara tayo ng utak in terms of about the vaccination, but we just have to remember to know and to read and to educate ourselves as well. Yun lang po.
Ganda ng sinabi ni Sir Pete, no? Particularly yung fact na you don't have to have condition or even have a significant other, anyone close to you to have the condition to become a champion for the protection as well as the strengthening of the services that can help those who are experiencing difficulties related to that condition. Ang ganda, because everyone can be an ally, everyone can be a champion of the advocacy without necessarily having the disease or the condition themselves. Ang ganda. Everyone can play their part to help make the world a healthier place. So, perhaps we can now jump to the wonderful tandem from Papa, Miss Mai, and Sir Dwight. Any final thoughts po?
All right. So for me, again, thank you very much to Health. No, for us sa Popcom, our advocacy is always non-gender biased, inclusive, and we will always ensure a safe space for you. So if you need referral, there's always usap tayo sa family helpline that you can go to. You can get information also from there. We have the Popcom website for all the materials that you may need. No, as Dwight has mentioned, there is a sexually healthy and personally empowered adolescents module that can answer all your questions there. We have special there on SOGIE. And we will really ensure that no one is left behind, and we will always ensure that there will be safe spaces, and educate yourselves. There are always experts to help you navigate this journey. So to empower Filipino families, ayun, maraming salamat po. Turn this over to Dwight.
Sir Dwight.
Ayan, thank you, Miss Mai. Again, we would like to thank Dr. Dex sa pag-invite po sa amin sa Alaga Health na forum po na ito. Maraming pong salamat. As isa din po sa mga program na dinadala po ng Popcom, which is ang Responsible Parenthood and Family Planning, masasabi po nating parents need to be more accepting of their kids, no? And less concerned about what society thinks they might need to be. Ayan, kasi nag-uumpisa po tayo parate sa ating family. And let's create a safe place for our children, no, especially in dealing with their SOGIE. Kasi po, yun nga po sinasabi natin na nag-uumpisa lahat yung open communication, yung trust, yung atin pong tinatawag na respect. Nagsa-start po yan parati sa pamilya. So, as Popcom, sabi nga ni Miss Mai kanina, we empowering Filipino family. So let's start with our family first, no? Sa lalong-lalo na in dealing with SOGIE concerns ng atin pong mga kapatid. Again, maraming salamat, and happy Pride Month po sa lahat. Thank you very much.
Yeah. Thank you, Sir Dwight. No? And of course, last but not the least, our two lovely ladies, our two lovely physicians tonight, Doc Via and Doc Joan. So maybe we can start with Doc Via.
Alright. Again, happy Pride Month po sa ating mga friends from the LGBTQ community. Of course, we are with you in celebration and in jubilation of everything that you stand for. No? And 2 words maybe to end this, no? To end this celebration. Be kind. Those are simple but very powerful words that we can not only impart to our friends in the community, but also to the whole to the whole Philippines, to the whole it is by being kind not only to others but to ourselves that we are able to unite one another in that common goal, no? To be able to help each other as well. No? Para namang Miss Universe tong sagot ko. But really, taking care of yourself starts with being kind, no, to others and most especially to yourselves as well. No? And there will always be allies who will be there to address your needs, no, to be able to extend the helping hand from Popom, who is there to champion the health of our friends from the LGBTQ community, and of course the specialist, no, na palagi niyo pong kaagapay sa hirap at ginhawa, no, sa inyong kalusugan, no. Palagi pong nandyan po yung mga doktor, nurse, public health workers who will always be there to champion the rights of the community. Kung huwag po kayong mag-atubiling magtanong, kung meron po kayong mga katanungan na bumabagabag sa inyong isipan. No? And always be kind to yourself, no? Especially since we are in constant battle of what we believe in, especially in defending our advocacy, no, and in pushing for our advocacy, no, to be able to care for the health and well-being of our friends from the LGBTQ community. With that, no, I'd like to end this night with celebration of love and of happiness. Of course, we are with our LGBTQ community, no, in that celebration. So, happy Pride Month ulit, and magkita-kita tayo next time, no, sa next Alaga Health Live.
Thank you, Doc Bia. And now, finally, Doc Joe.
Yes, again, happy Pride Month celebration to everyone from the LGBTQI+ community. Kasi nasabi na nila lahat, so I would just like to encapsulate everything. O, diba? I-ano ko na lang siya. I-encapsulate everything. Number one, being a member of the LGBTQ community, it's normal. It is not never a mental health disorder. So wag niyo pong isipin na may problem, may something wrong with it. So do not feel guilty. Be proud, no? And I'm sure na you are all very brave to show your true colors. So be proud, just show it, express it. And lastly, you are more than capable of achieving all of your dreams, all of your goals, all of your desires. So wag magpa-dictate kung ano ang kaya, kung ano hindi kaya, because we are members of the LGBTQ community. Hindi po ganon. All of you are capable of achieving all of your highest potentials, and we are all in this together. Andito po kami always as your allies and partners. So walang iwanan always, because at the end of the day, we are all equal, we are all the same, we are all human beings. Maraming salamat po.
All right, there you have it. Thank you very much, Dr. Joan. Thank you, everyone, for being part of tonight's Alaga Health Live. As you can see, regardless of where we are, tuloy na tuloy pa rin ang Alaga Health Live, because healthcare should be made available anytime, anywhere, in every way. Yan po ang paniniwala ng Alaga Health. So, I guess I will see you all next week for another episode. And next week, ang ganda po ng topic natin dahil makakasama po natin mga specialist na ang itatakal naman ay mga allergies. Mapabalat man yan sa ilong o iba pang bahagi ng katawan. When it's allergy, punta po kayo sa Alaga Health Live next week. So once again, I'm Doc Dexter Galban, and this is Alaga Health Live. Good evening, everyone!